I am joined now by Andrew Scott. Thanks for sitting down with me this morning.
Thank you.
How are you doing so far?
I'm good, thank you.
Great. You've taken in some good sessions, chatted with some colleagues.
Yes,
Yeah.
I mean, it's early in the meeting, but the opportunity to actually meet people for the first time in 2 years in person has been terrific.
I know.
And I'm looking forward to the rest of the meeting.
Excellent. I want to start off talking about some challenges in oncology and therapy right now.
Well, I think that aligned with opportunities are always challenges. And so I think the key issues that we need to face at the moment are how do we develop the evidence to be able to, for nuclear medicine imaging and therapy, obtain the approvals and the funding that we need for the opportunities that we can see that are there. Right. We know, for example, that there are imaging studies which are approved in the US, which aren't approved in other countries, and vice versa. So I think being able to generate the data and to be able to use that to achieve the regulatory and funding approvals are one of the main challenges. One of the programs that I'm involved with at the moment is with the International Atomic Energy Agency, particularly looking at access and availability for imaging and therapy for nuclear medicine in low and middle income countries, which, when you think about it, is 3/4 of the world's population. And so we're looking at ways we can try and improve that, and we have a number of initiatives at this stage we're pursuing.
What are some opportunities that you mentioned that you're looking
Yes.
forward to making happen, or you're
Yes.
seeing things open up right now?
Well, I think that we're in probably one of the most positive stages of nuclear medicine that I've seen in my career. The number of new imaging and therapeutic opportunities are enormous. The dotatate and the PSMA therapies that have been approved in the US, poised for PSMA in Europe, and for the rest of the world waiting to be able to get access on a more routine basis, is really going to transform the way that nuclear medicine is practiced. And I think from an opportunity perspective, that's enormous. But we have some challenges there too. So how do we have the workforce that we need? How do we get access to some of these new therapeutics in ways that will provide equity for patients that really need the treatments? From an imaging perspective, again, I think we're poised for enormous progress as well. I mean, PET clearly continues to expand. There's so many new traces which are being investigated in oncology as well as in many other types of nuclear medicine indications. And I think that those also will continue to expand into the future as well.
Wow, very exciting.
Yeah.
Anything that you haven't mentioned that you're looking forward to learning more about, or you're particularly excited about?
Well, I think that there are some really exciting innovations in both technology as well as in traces, which will be presented at this meeting that I'm very much looking forward to. So from a technology perspective, I think some of the newer generation digital PET and SPECT cameras are very exciting. Certainly the whole body systems are looking incredibly exciting, although they're quite expensive, so not everyone will be able to access them. But also from the chemistry side, looking at the ways that new synthesis techniques can be used, and analysis with AI machine learning. I think there's some huge advances being developed there as well.
Well, fascinating. I hope you have a great next few days.
Okay, thank you.
Thanks for sitting down with me.
Thank you very much.